So disorders of gut-brain interaction are previously called functional GI disorders. They're going to be a group of more than 30 conditions without any structural, biochemical, or infectious causes. So they're really stemming from a dysregulated communication between the brain and the gut. The common ones that I see in the clinic are going to be irritable bowel syndrome, either with diarrhea or with constipation, and then sometimes some sort of functional dyspepsia. Right. So when you're seeing a patient with a suspected disorder of gut-brain interaction, the first thing you're going to want to do is rule out alarm symptoms, things that might trigger you to do a more in-depth investigation before making your diagnosis. So if your patient just started with symptoms such as like above the age of 50, perhaps they have some other things going on like significant unplanned weight loss or anemia, those sort of things would prompt you to do more in-depth evaluation like a colonoscopy or an endoscopy. But for a lot of these disorders of gut-brain interaction, they're going to be based, the diagnosis is going to be based on the Rome criteria. And so it's a positive diagnosis that you can make based on their symptoms, which is different from what we used to think when we used to think it was more of a diagnosis of exclusion, where we would order all sorts of different tests for these patients. And then if everything came back normal, we would say, oh, well, I guess you probably have irritable bowel syndrome. I'm sure. So, because it's the bidirectional interconnections between the brain and the gut, this is what constitutes the fundamental basis for using brain gut behavioral therapy and neuromodulators in the treatment of these patients. So, brain gut behavioral therapies are going to be interventions that are targeted to address the GI symptoms rather than to improve the psychological comorbidities, but they actually can have a positive impact on both GI symptoms and psychological issues such as anxiety or depression. And then another common treatment used in disorders of gut-brain interaction are neuromodulators, which are medications like antidepressants, antipsychotics, and other medications that target the central nervous system. And they work on the neurotransmitters that impact the gut and the symptoms. So what you really need to look at when you're treating any patient with a disorder of gut-brain interaction is what really is bothering them most. A lot of these patients have comorbid psychiatric conditions like depression or anxiety. If they really were most bothered by depression, you would treat them differently. You would start with symptomatic medical treatment, maybe something to address their diarrhea, possibly lifestyle intervention, diet changes. But then for those patients, the most appropriate treatment would be to refer to psychiatry. And then you could work with a psychiatrist to prescribe some sort of medication that would help their depression and possibly their GI symptoms. Other patients, though, they may be more bothered by the specific GI symptom that they're having. So maybe they're just really wanting somebody to address their diarrhea. For those patients, you would, again, start with a symptomatic medical treatment, diet modification. But the next step for that patient might be a central neuromodulator that would have some impact on their bowel habit and also maybe any pain they were having. So I think the most important thing when you're treating patients with disorders of gut-brain interaction is to explain to them the pathophysiology behind their disorder, that it's a real disorder. It definitely has a pathophysiology. It's just not as easily measured as, say, somebody that has inflammatory bowel disease or esophagitis, and educate them about this dysregulated communication between their brain and the gut as the cause of their symptoms. And then once you let them know that you know they have a real disorder, that you don't think it's all in their head or that they're crazy, then you can talk to them about some of the different treatment options. Again, explaining to them that these treatments are targeted to kind of normalize their communication between their brain and their gut. Also, patients should be educated about the side effects of the possible medications, what to expect as far as treatment response. You know, it's important that they know it may take several weeks before they see any symptom improvement. They need to be involved because it may be an expensive medication. So letting them sort of let you know what they're comfortable putting out there as far as financially. And then also, if you're referring them to a mental health specialist, again, you want to make sure that you're talking to them about why you're referring them so that the mental health specialist can help them learn to better handle their stress response so that their symptoms don't play as big a role in their life as they currently are.